Miss Imani. We are going to go ahead and get started with your examination today. So I do have a couple of things that I want to go over with you initially.
Sure.
So it looks like you were referred to me by your primary care physician. As far as I can tell, you were referred by Dr. Swinberg, so that is good. I do have your chart relayed here. So we are going to get started with a couple of things. Of course, to start, if I could just have you confirm your name for me.
Yes, Imani.
Perfect. Thank you very much.
Sure.
And then it looks like I have you here for a complete assessment. It looks like you had a possible reaction, but you're not quite sure if it was in fact allergic.
That's right, yeah. I went out to eat like a week ago and I just was experiencing some tingling in my hand. So this was referred here to come get it checked out.
Got it. Okay, so maybe you ate something and you aren't quite sure if it's correlated.
Right, yeah.
Okay. All right, well, it's good that you came in. Next few questions are just about symptoms that you might be having.
Okay.
Any recent headaches, related or unrelated?
No.
No migraines as well?
No.
Okay. Any itchiness associated or not associated?
No.
Any rashes or like hives?
No.
Okay. No peeling of the skin or bubbling, blistering?
No.
Good. Okay. Any abnormal textures?
No.
No. Good. Any issues with hair loss?
No.
Okay. Any issues with your sleep routine or trouble sleeping, trouble staying asleep?
Not really, no.
No more than the normal?
Right, yeah.
Okay. Are you in any pain or have you had any pain recently?
Minor, just
Minor?
from the tingling.
Okay. So isolated to that area?
Yeah.
And that's your left side, correct?
Yes.
Okay. So we will definitely be having a look at that.
Sure.
Excuse me.
Sure.
So we're just going to move into our second portion of the examination, which is going to be the inspection.
Okay.
So I obviously want to have a look at the area, see if there's anything I notice externally that is abnormal, and then we'll kind of go from there.
Okay. Sounds good.
Perfect. So I'm just going to set this aside. If I could have you just bring your left hand to the table for me.
Sure.
Is it okay if we roll your sleeve up
No
a
problem.
little bit?
Yeah.
Okay, perfect.
So what's up?
That's okay. That's fine. I just want to have enough room for the panel. So I am going to have a look. Let me just clean my hands. Just having a look visually, I'm not seeing anything right off the bat. I do see a slight discoloration that I will have a look at.
Sure.
Okay, so just gonna have a look at the area. Can you show me where about on your hand or arm you were experiencing the tingling?
Primarily here in my lower fingers.
Okay. So I'm just gonna look to see if I notice anything abnormal. It doesn't look swollen. I do see a little bit. This obviously is from your sweater, but I do see a small mark of discoloration there. Is that something that you've had?
Yes.
Okay. Okay, so that's not new. Just looking for any signs of abnormal texture. Also looking at your veins, looking for any signs of distension, which I don't see. Hair growth appears normal. I'm not noticing any abnormal pattern there, which is a good sign. Okay, so let me just get my gloves on so we can have a closer look. So far externally, I'm not seeing anything, which is a good sign.
Sure.
All right, so I'm just going to have a bit of a better look here. So just going to feel around a little bit, assessing for any textural abnormalities. So sometimes we can't see what's underneath the surface of the skin, so I just want to feel for any possible bumps that could be underlying here. Are you currently in any pain anywhere in this area?
Not in that area now.
Skin texture itself is very smooth and dry to the touch, but does appear well moisturized. I'm not noting any abnormalities there. Skin color is consistent. I'm not noticing any abnormal redness. Slight peeking of the hand, which is totally normal. Any pain in your fingers at all?
Minor.
Minor?
Yeah.
Okay. Is it like kind of like a dull pain or like a sharpness?
A little bit of a sharpness.
A little bit of a sharpness. Okay. And is that upon manipulation, or do you feel it all the time?
Yeah, a little both.
A little bit.
Yeah.
So that's something I'll look out for. Okay. So I'm just gonna squeeze your finger slightly here, assessing for your capillary refill. Essentially that means I'm just occluding the blood flow and then allowing it to return, checking for normal reactivity there, which is present. Good. Okay. So I'm going to have you just turn your hand over for me. Again, I'm not noting any abnormalities here. No pain in your joint here?
No.
Good. Beautiful nails, very well manicured.
Thank you.
Just assessing for any edema at the top of the hand, which I'm not noting. So sometimes with an allergic reaction, we get swelling of like the hands or extremities, and I don't see any of that here, which is good. And this incident occurred about 2 days ago, correct?
Yes.
Okay. Thank you. Also, just having a look at the cuticle itself, sometimes any kind of dermatitis, rashes, or dryness that occurs there can be an indication that something is wrong, but I don't notice that here. So, just gonna have a look at the top portion here. So again, hair growth is very normal. Looking at the direction as well as the pattern, and skin texture on the dorsal portion is even. Okay, so I'm just going to have a look at the very top of your fingers here, and that looks okay. Okay, so you can relax your hand down for me. So externally, I'm honestly not seeing anything that looks concerning, so that is a good sign. There's no sign of rash or any abnormal discoloration or any openings or lesions that would lead me to be concerned, so that is very good.
Okay.
So let me just take a quick note here. Okay, so I'm going to perform a couple of palpations. Essentially what that means is I'm just going to use my hands to kind of manipulate you in a certain way.
Okay.
So just bear with me. If you feel any pain, please do let me know, because
Sure.
I want to kind of isolate areas that are causing you any discomfort here. Now just to follow up on the incident, when you experienced the tingling, was it like immediately after you ate? Like how long after you ate the tofu would you say?
Probably within the hour.
Within the hour, so fairly quickly.
Mm-hmm.
And is this something that you've experienced before?
No.
And it hasn't dissipated since, meaning you're still experiencing the tingling?
Yeah. Mm-hmm.
Okay. And there was no other incidents of injury prior to this, like you didn't hit your hand on anything, nothing like that?
No.
Okay. So I'm essentially feeling around the joints to see if there are any signs of inflammation. Sometimes we can get a tingling sensation if we have undiagnosed psoriatic arthritis.
Mm-hmm.
So psoriatic arthritis essentially is, you may have heard of psoriasis, which is like a type of inflammatory disease that affects the skin topically.
Right.
Now a certain number of patients do have what's known as psoriatic arthritis, which just means you have psoriasis internally on the joints, which can cause swelling, inflammation, sometimes discoloration, every once in a while tingling.
Right.
So just making sure that I'm not feeling any abnormality there. Now, have you noticed any stiffening of your joints at all, specifically around the affected area?
No, not really.
No. Okay, good. Okay. All right, so I'm just going to take a couple quick measurements here. I just want to see if we're getting about an average. So I'm just going to measure underneath here. Okay. So measurements look normal. I'm not noting any swelling. So I think the next thing I'm going to do is just check for any temperature variation.
Sure.
So I'm just going to make sure this is turned off because it's a little loud. So essentially, I'm just going to check to see if there's any major variation in temperature. So sometimes the hands can either be warmer or colder, which is normal. Obviously, we don't want to see a big jump in temperature because that would indicate that there could be a risk of infection, or any internal swelling. So just checking here. Your hand is warmer, but it is still within normal limits. Fingers are just a tad cold. That's okay. It is getting a little bit chilly. And specifically checking over your veins, looking for any signs of inflammation there. Good. Okay, so all of that is normal. All right. So I would say we can go ahead and get started with your examination.
Sure.
I'm sorry, with the allergy portion of your examination. So what I'm going to do is place this allergy band on your other hand. Now the purpose for this obviously is in case of an emergency. If you do go into anaphylactic shock, I don't think that's going to happen today.
Yeah.
But we need to have this on you just so that everyone, all of the medical staff knows that you have had allergens applied to your skin. Okay?
Sure.
So this will just clip on, and then obviously we will take it off once your examination is complete.
Okay.
So I am going to prep and cleanse the area. So if I could have you just come a little bit closer here for me, if that's all right. Perfect. Okay. So, let's see. So I'm just going to place this cloth underneath your hand.
Sure.
You can go ahead and relax on top of that for me. That's just going to give us a nice clean working surface.
Sure.
Okay. Now I'm going to go ahead and prep the area. This is ChloraPrep. Essentially, it's just concentrated chlorhexidine and alcohol, which is just a topical cleanser. So it's just going to clean the skin, remove any debris or bacteria. It is fairly cold, so just to give you a warning.
Thank you.
So I'm just going to allow that a second or two to dry. Sure. It's going to feel just a little bit tacky. That will go away.
Okay.
I'm going to create a little bit of a grid so that we have a pattern to work with. So just bear with me as I get this ready. So now we have a nice little working area there. That way we don't mix up any of the allergens. It also provides a barrier so that none of them penetrate through the other side.
Sure.
Okay. So I am going to begin applying them now. I have it nearby. Okay, so I have a couple different sections and they are kind of color coded. I will be testing a couple different kinds. So we're going to do environmental allergens as well as obviously things that you would be eating, and then a couple other ones that you might come in contact with, like mold, that kind of thing. So dust mites are very common, so we definitely want to test for that. Okay, so we are going to go in with our first one, and we're going to start with soy since we think that might be the suspected allergen here. So this first one, we will see if we get a positive reaction. And I am just applying a very small amount today because you haven't had an allergy test before and we don't want to kind of overdo it for the first one. So if any of these do produce a positive reaction, then we can do a follow-up test and see what exactly is going on. But for the first test, I just want to gauge whether or not you are actually allergic.
Okay.
For our second one, we're going to test for eggs. Do you eat eggs frequently?
Yes.
Okay. So likely not the cause. Did you happen to have eggs the day that you had soy?
I did actually.
You did. Okay. Just making sure we don't contaminate anything here. The next one we're testing for is gluten. So this is a common one that we've seen recently that's kind of become trendy. People have gluten allergies. Now gluten intolerance is actually a medical condition, and it is very common. It's in things like bread, pasta, that kind of thing. So we do want to go ahead and test for this. I would be very sad if I was allergic to gluten.
Likewise.
All right, so the next thing we're going to test for is cat dander. So you said you came in contact with a cat recently, so we do want to make sure that you didn't have an allergy there. It is fairly common. Unfortunately, our kind of seasonal allergies can tend to act up around this time of year, but cats are bringing in their winter hair and they're producing more dander as well around this time of year. So we do see an influx of people having allergies to pets, unfortunately. Okay, so the next one we are going to go in with is mold. So mold is an important one because it's not always visible. So do you want to go ahead and test for this? And we are moving on. We're testing you for ragweed. So ragweed is a common allergen that we come in contact with outside. So essentially another form of pollen. If you've been in the grass recently or anything like that, it'll test for any allergens there. going to go ahead and test you for yeast. So yeast is kind of a 2-for-1. You can be consuming yeast if you're eating things like sourdough bread. Certain baking recipes call for yeast. It's also something that you can come in contact with topically, like a yeast infection, that kind of thing. So and lastly, okay, so let's go ahead and test you for fungus. We're gonna let these sit on for about 20 minutes.
Okay.
So I am going to cover them essentially to concentrate the formula so that we can ensure they are staying on you topically. And then I will leave you for a few minutes, come back in after the 20-minute timer, and then we'll check to see if we've got a positive reaction anywhere.
Okay.
In that time, you might experience some discomfort. If you do have a positive reaction specifically to the histamine, it will be slightly itchy, shouldn't be kind of overtly uncomfortable. If it becomes so uncomfortable that you want to take it off, you can hit your call button and I will come in for you, okay?
Okay.
Okay, so just going to apply these patches, and as I stated, it's just going to essentially allow the formula to concentrate onto the skin. This is your first allergy test, correct?
Yes.
Okay. All right, Miss Imani, it's been about 25 minutes. I apologize for the delay. How are you feeling?
Pretty good.
Pretty good, not too bad?
Not too bad, yeah.
Okay, so I do see right off the bat, obviously, we have a negative reaction to the saline, which is what we wanted, and then there is a slightly positive indication to the histamine, which indicates that you did have the positive reaction to the control, which is good.
Sure.
So that's what we want to see, so let me just go ahead and mark that down. So we're going to go ahead and assess the areas underneath and see if you had any reactions. So let's have a look and see if any of our allergens are irritating your skin. Are you feeling any symptoms as far as like scratchy throat, dry or runny nose, watery eyes, itchy?
No.
No? Good. Okay, so we're going to go ahead and remove these. So our first soy, which is what we were possibly suspecting, is actually negative. So I'm not seeing any reaction there.
Okay.
So it's unlikely that the tofu is what caused your symptoms.
Sure.
Okay, so I would say if you don't normally consume soy, but you probably are okay to go ahead and do that, okay?
Okay.
Eggs, not something we were suspecting, and it is negative, so that's very good. Gluten, so our pasta, bread, you are good to go.
Good.
That's the one that everyone's always worried about, so you're okay with that.
Good.
The This next one is for cats, so I am curious to see if this was the cause. And it was not. Reaction is negative, so you are not allergic to cats.
Okay.
Let's say our grass. Again, negative. This was for pollen, seasonal pollen. Negative, so you should be okay there.
Good.
So this was our yeast. Again, negative. Okay, we're coming down to the wire here. Let's see. So this was our fungus, so common fungus.
Okay.
We would do a secondary examination, to see what exactly it was. So this is just kind of testing you for a fungus panel. Could be mushrooms, could be certain kinds of very specific mold spores. If it's positive, we would have to do a more intensive panel. So.
Okay.
And it is negative.
Awesome.
Okay, so good news and bad news, I guess. Good news is none of them are positive with the exception of the control. I will have a bit of a closer look with my light just to make sure that there's nothing I'm missing, but I really am not seeing any sort of reaction here. So curious what might have been causing your symptoms if not a reaction to some sort of histamine. Does anyone in your family have allergies?
Not that I know of.
No? Okay. So they do tend to be genetic.
Okay.
So that's good news. Apologize if that's pulling your skin there.
Right.
So I'm just going to have a look. This is essentially a magnifying glass. It's just going to allow me to have a look closer at your skin. So just bear with me for a second. I just want to make sure I'm not missing anything. So I don't see anything on the soy. I would say that's definitely negative. Okay. Well, I can confirm that they were all negative, so it does not appear as if the issue was caused by an allergen, at least not something that we tested you for today.
Okay.
Now, I can't say with confidence that it's not possible that you're allergic to something else. Whatever they cook the tofu in, whether it was like a sesame oil, peanut oil, all of those could be possible reactions. But those are things that you have had before. So I would say I'm a little bit concerned neurologically, more so because of the tingling sensation. That is quite abnormal, especially since it hasn't gone away.
Right.
And it's been about 2 days, at least 48 hours. So I think I do want to go ahead and refer you out to someone else.
Okay.
Let me go ahead and remove that for you, and then I will kind of clean up the area, and then we'll discuss it a little bit further. That is dry. So I'm just going to apply a bit of a topical ointment. Now this is Phytoplex. Essentially just contains glycerin, which is just going to soothe the skin a little bit, okay? So I would just let your sleeve remain up for a little while, allow this to kind of soak into the skin, and then once that histamine reaction has dissipated, maybe 15-20 minutes, you should be good to go.
Okay.
Just want to make sure that it's fully incorporated. Okay. All right, so I think what I want to do is refer you out to Dr. Kelly. So Dr. Kelly is a colleague of mine. She is a neurologist, but she also specializes in neuropathy and neurological disorders that kind of affect the limbs. She will likely also test you for any sensory deficits, so that's something that she likes to incorporate into her examinations, especially when there's any tingling going on. Have you had any numbness in the fingers?
No, not that I noticed.
No. Okay. So just going to note that so that I can send her over a report prior to your arrival. Okay. All right. Well, I apologize that I wasn't able to find what was the cause of your concern today. I do think Dr. Kelly will be a good person to have a look, and she will likely be able to figure out what is going on with you.
Sure.
So I will send that referral over to her. Her schedule tends to be a little bit busy. I will try to see if she can make that a priority. That way she can get you in rather quickly.
Okay.
So I would look out for either a call or email from her office.
Sure.
Are those appropriate ways to contact
Yep.
you? Okay. Perfect. So I will go ahead and send that over now so that she can get started on that for you. And like I said, I'm sorry. I hope she is able to figure out what's going on, okay?
Yes, thank you.
All right. So give that just a couple minutes. You can either wipe it off or just roll your sleeve down.
Sure.
Okay. All right. Thank you. Have a
Thank
good
you.
evening.
You too.